Natasha mentioned we're going to use a simple example donut quality, and you'll see that while it is a simple thing, it really is complex in the number of components that actually contribute to the quality. So at the right side, I've written great tasting donuts, and it's very important that everybody agree on what it is you're trying to break down here. Because if different people have something different in mind, like we're talking here about the taste of donuts, we're not talking about how economical it is to produce in mass or you know, what the individual cost of producing a donut is, because that would be a totally different chart. So great tasting donuts, and then the first thing you do is you put a line across the page with an arrow to great tasting donuts. These charts have also been called by some people fishbone charts, and you'll see as we go through why they get that name as well. So the first thing that you want to do is identify major categories of the causes. And we're looking for general categories here that we will drill down through and break down further into things that we can actually control. So I've listed here, and I'm not a donut making expert. I certainly eat more than my share of donuts, but the four main areas that I've identified are ingredients, transportation, storage, and production. And those are, in my opinion, the four major categories that will affect the taste of donuts. Now, what I'm going to do is each next slide will break down each of these into subcomponents, working to get at, again, things that we can actually control. So started with storage. And when you look at storage, you know, obviously, if you make donuts and you've got to store them somewhere, you have to have the conditions right, or the donuts won't keep their flavor and won't be fresh. So things like configuration of the storage area. Is there a possibility for contamination to come into play? And that can be affected by the packaging. How long are you leaving the donuts in storage, and do you have a policy that dictates whether you should leave them for a certain length of time or not? The conditions of the storage, the humidity and the temperature. So now when you see this, we can control the temperature and humidity in the storage area. We can control the packaging. We can have policy in place regarding all of these things, and also the time that you leave it in storage. So we've broken it down to smaller sub-issues that we can actually now start researching about.
Sure. I do have an 8 o'clock question.
So when we go to ingredients, and again, depending on your size of operation, a lot of the big donut places get pre-mixed dry ingredients, and then they have to add the liquid like water and milk and eggs, and then they would have fruit. So you look at the options you have here. If you're using water, are you just using tap water, or do you filter it? Anyone that lives in an area where there's water that's heavily chlorinated, you know that filtering it can really change the taste of the water and the impact on the end product. When you get into milk, flour, and eggs, there are a lot of different considerations. One of them is, do you want to go organic? And remember, I said at the beginning, we're talking about the taste of donuts. We're not talking about the price, because we know that if you start buying organic ingredients, that the price is going to go up. The question is, do the organic ingredients really affect the taste? And that's one place where you'd probably have to get more data. For fruit, you can use frozen fruit, you can use fresh fruit. In either case, you could get organic or non-organic. And again, you might need to do some research into how that actually affects the taste. But those are all different parameters that can be brought to the table for consideration. So if you get into transportation, now again, if you're not making your donuts at the place where you're selling them, then you've got to get them to where they're being sold. So you get the distance traveled is an important issue. The conditions of the transportation. Are they in a controlled environment during that transport? The time lapse. Are they traveling for an hour? Or are they traveling for 3 days? And again, if the transportation requires them to go into a warehouse somewhere, you get the conditions of the warehouse, which then brings all the storage back into play. And one of the things that you'll find in using these charts is that some things keep coming up again and again and again. As you're breaking down, there's all kinds of repeats where you could actually take a major section and sub it into another one. And those are things that you know then are important for you to deal with because they're influencing a lot of the different factors. And then packaging. Again, packaging was important in the storage. It's also important in the transportation. So last, we're going to look at production. And I have not really dealt extensively with production because I am not a master donut maker, but there are some areas that we know are important. The temperature of the oil. If your oil is not at the right temperature, your donuts will absorb too much oil, and you have to change the oil on a frequent basis in order to keep it fresh and the quality up. You should have policies and procedures that would work along for the oil change as well as other things. The leavening process, which is how the dough rises. You can use yeast or you can use baking soda. If you use baking soda, you get a much more dense donut, but it's a faster process. If you use yeast, you need 3 to 4 hours for the dough to rise, but you end up with a light, fluffy donut. So again, you've got to weigh all that out as to what type of donut you want to make. The setting time is if you're using yeast, that's how long you let the dough rise for, and then temperature of the warm box, that's where the rising actually happens. If it's too warm, it won't rise properly. If it's not warm enough, it won't rise at all. And then, of course, the big issue, the personnel. If you're running a shift operation and you've got different people that are running the production facility, they could produce different quality donuts because they do things slightly differently. So again, if you're getting variation in your donut quality, you may want to start tracking data by shift so that you can see which particular people are making the better or the worse donut. Now, this is the chart when it's all broken down, and as you can see, it's not really that simple a process. There's all kinds of things that interact with one another. And the beauty of a chart like this is you can look at it and you can say, well, who do I need at the table that isn't here? If I wanted to bring a table of people together for donut quality, I would want a farmer. I would want somebody who is involved in transportation, someone who's involved in warehousing, as well as people from production. And you tend to think, oh, you just have production people around the table, but then you're missing these other very important components. If you had the best baker in the world and the finest ingredients you could get, but the transportation wasn't done properly, you still wouldn't end up with the best donut. So all of these things are interrelated, and the chart shows those interrelationships.
Thanks, Gary. And we just had a couple of comments in the comments box that people are having a little bit of trouble connecting the donut example to poverty reduction. So it's great that we're going to next get into. Yeah.
Yes. And I just wanted to quickly put up this chart that came along with the slide deck is something that we did here several years ago at United Way, Sault Ste. Marie and Algoma District. We have a program called Community Assistance Trust Program, and we assist people with rent and food and help with hydro bills and dental, emergency dental and eye care and medical travel. And we started out with a budget of, in 2001, $60,000 a year, and we thought, well, that's great. We're going to help everybody in Sault Ste. Marie with this program. We're now up to about $500,000 a year, and it's not enough. So we did this chart to find out why is the demand continually going up? What are all the factors? And of course, this is similar to doing a poverty one, but you can see that it's quite complex. You know, mental health issues, poverty is one whole line here, and self-harm, disabilities, all these different issues that require people then to need to use social service programs. So what I'm going to do is jump into the poverty one right away so that people can see where we go with this. Now, I want to say that I've done this in a Word document, and I've pre-done the chart. You can actually get canned programs that will do these types of templates for you. Lucid Chart is one, Reality Charting is another, QI Macros is another. But I've done them in Word, I've done them in Excel, I've done them in PowerPoint. So it's a matter of picking the drawing tools and just creating the chart. So the question I would have for the group is, if poverty is the issue that we're looking at, what are the major categories that cause poverty? So I've got room for 6 of them here. So does anybody have any suggestions as to why we have poverty in communities?
Unemployment.
Unemployment? Okay, so do you think that unemployment is a major category, or is it a subset of something else?
Or underemployed.
Okay, so unemployment or underemployed?
Maybe a subcategory.
And the nice thing about these charts is that later down the road you might say, well, we're going to move that around. It isn't that isn't where we want it. And of course, they're a work in progress, so you can change it as many times as you need to. And as you learn more, then you would make those changes. So unemployment and underemployment. Okay. Any other major categories?
We also have income. Yvonne has written in.
Okay. So income falls under this unemployment and underemployment box. So would everybody be okay if I moved that down one and put income as the main category?
I think income should be its own category.
Apart from unemployment and underemployment?
Yeah.
Okay.
So it can be income security.
Right. Okay.
We also have government policy has been mentioned.
Okay.
I think there's probably more than 6 here.
Yeah, that's fine, because we can add more if we need to.
What about education?
Okay. Do you think education is a major category, or does it fall under one of the ones that we've listed so far?
You can still see the skin on them. Really good.
It may be sub, because if your education is low or no education, it would affect income or employment. It wouldn't make you as employable, no?
Right. And so when I wanted to get the major headings first, but as you drill down, so you'd say, okay, you ask the question, why are people unemployed or underemployed? So education could be one of those components. Is everybody good with that?
Yeah. Completely. I think it's directly related to employment.
I'm sorry?
Education is directly related to a level of employment, which in turn leads to income sustainability.
Right. So there will be some connection between these two, but let's leave them separate for now. Any other major categories? I'm sorry?
Mental health?
Yes. Do you want it as a separate heading?
Yeah.
I'm also seeing health and health equity in the chat box, so I wonder if it's mental health and health.
Okay. Mental health and health. Okay. Any other major categories?
What about immigration or prejudice? I see racism in the chat. I don't know. That's two. So there's immigration, but I just seen racism by Don. I think it was. You said it.
Okay.
Yeah, I think you know, reading the poverty reduction reports that have been done recently in BC, that was one of the major contributors that came up over and over, this racism.
What's going on here?
Put in here before we start drilling down a bit.
Sorry, go ahead.
Transportation is a huge issue here in Hawkesbury. We have no buses.
And housing.
Housing for us is critical here in Owen Sound and Grey Bruce. If you don't have housing, it's a huge stabilizer.
It's an interesting idea.
All right.
Use a formal dining room or living room. Some fun. Feels pretty good at the same time. No. Okay, maybe we should put. All right, I think I've got some ideas. What else are we looking at? Okay.
I'm just going to put housing in here.
Paint's only halfway up. Did you just start repainting? No, this was previously. Yeah, we haven't done it. 15 years. Too big a project to do.
And it's interesting, this looks like it's starting to reflect some of those 8 game changers that we talk about a lot of the time within vibrant communities.
You want to get rid of this wall? Yeah. As you can probably guess, this is a support wall. I'm assuming just on the lower.
I think the last ones that I'm seeing mentioned in the chat box that we haven't listed yet are food security, childcare, and community resources.
I personally think food security could go under transportation, because if you can't get to your food, you have no food security.
Well, that's a true statement, but I think that's only one portion of food security, because food security deals with the total food available in the area, education of people that are trying to grow their food or use food properly. So there's a lot of issues around food security other than just transportation. Although I agree that in rural areas, transportation is a very big component of food security.
I would say income is a greater impact on food security in terms of having the resources. If there's not public transportation, then can you afford a car? Can you access food? So having enough income to purchase healthy food, having enough income to drive to the food if you don't have public transportation, all of it to me links back to income as a priority for food that contributes to food security.
Okay, so I put food security under income. Have we got all the major ones down now, Natasha, that we're...
It looks like it. We just lost your screen again, Gary.
Okay, so, I think I will have to add another category for that.
What if we were to put like systematic barriers instead of government policy, and government policy could go under that as well as generational?
Yeah, I think that's, yeah.
That's a good suggestion. Systematic barriers, did you say?
Yes.
Oh, and Suzette just pointed out that we don't have childcare listed yet.
Okay. So do you think childcare would go under one of these that are out here? Could it go under income?
It could go under income or unemployment, actually.
Okay. Okay, so there was another one that we were going to put here. It was government policy, right?
No, generational poverty.
I'm sorry?
No, we have government policy already. We were going to put generational poverty.
Okay, but we took government policy out of the top here. So is generational poverty going under systematic barriers?
Yeah, you already have government policy under systematic barriers.
Ah, thank you. Okay, so generational. Okay. All right. So let's take the income one and break it down a little bit further. We've got food security. Education could come under this one as well, right?
For sure, and employment.
And so not surprising, we see that education and employment is one of the root causes.
Education and training, I would
Yes,
offer.
put that together.
Kim has also suggested that training and skills development might be a subcategory of employment.
Yes, absolutely.
I would also put government policy as a subcategory under income.
Yes. Okay, so let's see, under income, okay.
If you copy the box for government policy and just paste it under income.
Yeah.
Comment that when we look at employment, we need to talk about low hourly wages, low annual hours of work. So for example, precarious work, and then access to employment insurance benefits.
Okay, so that sounds like government policies again is a component, right? Because it's minimum wage, access to employment insurance.
Maybe both government, but also employer policy.
Okay.
And Larissa was saying yes, specifically labor market policy. And Kim is saying, I think food security is its own category with many things affecting it. It could be income, it could be transportation, it could be a lack of knowledge, that there are lots of people with an adequate income or an adequate earning who don't access or eat healthy food.
Okay.
So what do others think? Could food security be its own category, or does it fit nicely under income?
I think it should be its own category as well.
I agree.
Okay, so here, this was labor market.
Yep, labor market policy.
Okay. So we want to make food security its own. Okay.
Is there ever an end, Gary, at which the group wants to add more and more of those main categories, and we say, no, we have to scale this down, or do you just keep adding all of those categories?
Well, I think that as you have the discussion, and what you do is you get the main categories through a brainstorming session, and then what I would do if I was facilitating a session like this is I would then break out into groups. So if you had 6 main categories, you would form 6 groups, and then those groups would break down one of the categories. And then you would bring everybody back together, and you would see where the overlap is. And I think that there would be some that you would say, okay, that's not really its own category, it's a sub of this. And that discussion would come out at the tables. But it's really important that you have the right people in the room, because you need to have people that are familiar with all of these aspects. And the whole object of us doing this webinar was around the issue of, you know, how do we keep people at the table when we're focusing on one particular area. And as you can see, there's so much interaction. There's when you're dealing with one of them, with one major sub-issue, you're bringing a lot of the other ones in because poverty is so complex. So a chart like this helps people to see how they can be involved. You know, if you're dealing with unemployment and underemployment, we don't have here yet the supports in the community for people that might be visually impaired or hearing impaired or physically impaired. All those things help people to be employed, right? So all those supports. So all those organizations have a role to play. Mental health organizations have a role to play in helping people maintain employment. So, you know, there's a lot of different ways to bring people into the discussion. Hopefully this gives people the idea of how you go about it. And you can see that, you know, it could be different. The chart that we develop in Sault Ste. Marie might be slightly different than what you would develop in Halifax, because it depends on your local situation, and again, it depends somewhat on the people that are in the room as to how they see the problem and the components of the problem. But the big thing is you'll identify who you need to have at the table. You might say, oh, gee, you know, we don't have anybody who's knowledgeable of immigration, so we better bring them to the table. It'll identify where you might need to get some more data, labor market policies. What are our policies locally? What are the job opportunities locally? What are the needs for those jobs? So you can bring all of those people in and have those conversations. So I think that hopefully everyone will get the idea of what it is you do in the process, and certainly I would be happy to entertain any questions.
I did see one question from Jill in the chat box already, asking if other roundtables are using the intersectional approach. And Jill was also saying that they use a similar root cause analysis, taking on an entry point with their action groups, housing, food security, etc., and then roll it up as one in their roundtable meetings. Does that sound similar to what other people are doing?
I know in Sault Ste. Marie we have essential services as one major component. That is immediate needs, day-to-day needs of people, like the trust program I described. We have food security as another one, housing as another one, and workforce entry, which includes education and employment.
And it looks like Leanne has said that CAPRA, or Central Alberta, has had action committees representing those areas as well. Aaron, okay. Nicole is also saying that they have different action groups too: financial literacy, housing, mental health, poverty reduction, Indigenous, etc. Nicole, so do they all come to the table like one central roundtable afterwards, or do they just operate by themselves, or what does that look like in your community?
So we have something called Chilliwack Healthier Community, which brings together 42 partners or 40 plus partners in the community, and everybody from different sections. And then they've kind of developed these task teams or action groups around it. And then everybody reports back on a monthly basis just as to how things are moving. And then within those action groups, they have stakeholders from all different organizations as well. So it's kind of an overall look at it with each piece to the poverty plan, I think. But yet we've separated out the poverty reduction piece. So I think we've just kind of separated that out, but maybe shouldn't have completely separated it out. It gets part of the bigger piece.
And what issues are you running into there?
With respect to?
Separating out the poverty piece.
Well, I think we're just having a hard time identifying where we need to go because we want to look at all the different areas, community resources and food and transportation, and mental health is already being discussed at a different table, and housing is being discussed at a different table, and financial literacy is being discussed at a different table. So we're bringing them together, but you know, they're dealing with their own things. So I think it's finding something, probably food security and transportation would be the pieces that we're missing here in Chilliwack anyways.
Interesting. Is there anyone that's using it like a completely different model, or? Are there any specific questions about how to facilitate this cause and effect diagram, like Gary was showing us?
I've just got a comment with regards to how does that chart, I realize that it's a cause and effect. It's looking at the root causes. What follows with that in terms of how you identify whether you're doing individual basic needs or whether you're doing community change or whether you're doing policy advocacy? Because each of those boxes then unpacks into another whole realm of potential activities, outcomes that can have an impact on poverty reduction. And I have a hard time at the next stage of actually identifying what are the critical ones that will make the most change or have the greatest impact in reducing poverty in a community. So which one do you choose?
Certainly, there's a need to do some work in multiple areas. That's why, you know, poverty is a complex issue, and it needs to have multiple organizations working at it from different angles in order to actually move the needle on it. But one of the things you have to keep in mind is, what's the low-hanging fruit? Where can you get the biggest bang for the buck? So, you know, there are some issues that are very, very hard to move the needle on, and there are some that you can get immediate satisfaction from. So we went through that process in Sault Ste. Marie, and we found that there were a lot of people that were not getting the supports that they needed. They simply couldn't access government programs that they were entitled to because the forms were too complex, or they didn't even know that they were entitled to those programs. So we put in place what we call an essential services outreach worker, who is mobile and spends time at different community hubs throughout the community, and works entirely at getting people the supports they need. That was one area where we saw, you know, we can get some real traction here, because we see so many people come into the United Way office that are entitled to supports, and they just don't know how to get them. So we made a full-time position, and now we're at 1.5 full-time positions doing that work. There's another one we call an options navigator, and we fund the John Howard Society to put this one in place. And this is a person that actually walks the streets in the evening. He works non-traditional hours. He connects with people that are out and about and finds out whether there's an opportunity for them to get some additional training or to connect them with employment. He finds out what their barriers are and helps them to overcome the barriers so that they can access either employment or training. And again, that was one where we got some really quick, good success. Whereas changing government policy it's important, but it's a longer term fix. So you want to be doing other things rather than just focusing on that. If as a community, obviously there's some organizations that would feel that would be their focus. So I think you have to look at it overall and say, okay, for our organization or our table, what are our skill sets? What can we deal with, and where can we get some results? Because when you look at the diagrams, if you make advancements in any of the areas that are on the at the root cause area, you're going to have some improvement on the overall. But it's only when you get multiple work going on in multiple sections that you're really going to see a big change in the end result.
And Gary, it looks like Jill commented in the comments box. She agrees short and long-term gains are important. So how do you reflect that in the diagram? Or is that something that you reflect in the diagram?
No, you don't. You just take a look at the end causes. And as I said, sometimes you need more data to even know whether that's something you can do or not, or whether it's an issue that's the most important. But the chart just basically sends you in the direction. It tells you, okay, these are issues that are important. It doesn't talk about relative importance, and it doesn't talk about short-term versus long-term. That's something you have to assess as a group.
Thanks, Gary. Are there any other questions? One or two final questions for Gary or for each other?
Hi, Natasha. It's Phil from Chatham, Kent. Just to build off what Gary was saying, I really appreciated what Gary was saying. Thank you for saying that. For those who are not necessarily in a capacity where they have a large organization to fund multiple projects at once, for those who are sort of one project coordinator, either part-time or paid, full-time staff, very small budget. Based on what Gary said, it's one of those things where I think you have to pick, again, those low-hanging fruit, and you do things for the easy win success. For example, Paul always tells this story when I'm chatting with him, in that, there was a city that said, okay, we have 3,000 plus people on the affordable housing wait list for the city. We're going to pull a group together of 4 or 5 people. We're going to find the 300 people on this list that are the easiest to house, because many people need extra support, need this sort of housing style. And they worked over 6 months with the private sector and got those 300 people housed. Now, did that solve the entire issue? No. But now you have outcome numbers to report on, not only outputs, but now you have outcome measurements. And I think it's really important to mention that as we go forward, funding for our organizations, especially the smaller ones, it's very important that we have outcome models to move forward so we can prove to funders that we're actually having an impact, because I know we all have great intent. We all have impact in many ways, but funders do want to see that, especially when the top is cutting from the top, and we're especially at the provincial level right now. We have to make sure that our outcomes are strong to show that we're absolutely needed in our communities, which I know we all are.
Beautifully said, Philip. Thank you. I think that's a good place to leave the webinar for today. Lots of great comments and questions in the chat box that I'm sorry I don't think we were able to get to all of them. The last one, I think, was Larissa, who was just saying this would be a great exercise for doing community engagement. So thank you very much, Gary, for sharing this with us and putting your diagram skills and your facilitation skills to the test. I will send the recording and the notes in a follow-up email in a couple of days. Thank you to everybody who participated, shared your thoughts and ideas and questions. It's fantastic to be able to just kind of test tools out like this, brainstorm with the group. If you are interested in some upcoming learning, we have a few really great webinars coming up with Sylvia Choi, with Liz Weaver, with Mark Kabaj and Galen, some of our directors within Tamarack, February 14th, 25th, and March 12th. I will send the details for those webinars in the follow-up email. You can read more about them and register online. As well, if you haven't heard yet, we have a collective impact Train the Trainer coming up March 19th to the 20th. So get trained as a collective impact facilitator, and you can bring that back to your home community to kind of build the skills of the members in your communities as well. The registration link is at the bottom of your screen, and I'll send it to you in the follow-up email. As I mentioned, the notes and the recording will be available in a couple of days. And just a reminder to those, our next convener call is scheduled for March 5th. We are actually going to do an Eastern PIP, but we'll invite lots of members from the West as well. This one is going to be around re-engaging business. London is going to be taking the lead on sharing their content, and we'll have a few people around the table to do a little back and forth with that PIP. I will send out the reminder or the notification to everybody. If I have not tapped you on the shoulder yet and you would like to participate in that business PIP, please let me know and I will send you the dial-in details. So once again, thank you to Gary and to everybody for being on today's call. We will connect with you again shortly. Have a great afternoon.
Thank you.